Good afternoon, folks. Judge Executive Al Mattingly here. I have Mayor Tom Watson with us, Dr. DuFrayne from Owensboro Health, and Clay Horton from Green River District Health Department. I think back toward the end of June, I said that I hope that we would never have another one of these conferences, but we find it necessary, I think, to get back together for a little while. I just want to do a quick update. Jordan, do you have those map comparisons? On the screen right now, we're looking at the 6/23/2021 map, and you'll see Daviess County had 1.4 cases per day. You'll see lots of green and yellow, a few orange, no red. Show us a picture of what we are today. There we are today, and you're going to see particularly that little cluster there in the northwestern part of the state. That's mainly the Grad region with McLean County right dead in the center, but there are many more red counties than there are green and many more orange counties than there are yellow. That's just showing you the resurgence of the COVID virus in our community. This is as of yesterday, 7/26. So in just a little over a month, we have gone back to really being in a surge. Jordan, next little picture. July 5th through the 11th, we had 28 cases. 12th through the 18th, 81, 209 cases. And Clay will tell us here pretty soon what the number of cases that we had just this past 2 or 3 days, but you can see it's an exponential increase. Next slide, Jordan. 44% of the Daviess County population has been vaccinated. I think about 53% of those who are 18 and above. State average for the total population is 51%, so we're a little bit behind there. If you looked at the number of seniors that are vaccinated, and by those I mean 65 plus, we're around 83%, and that compares very well. Well, the state average is 83%, and I think we'll probably talk about that and what we're seeing in the COVID cases, and particularly in deaths here upcoming. So with that, without spending any more time, because I want to get to the folks who are with us today, have them talk to us a little bit, and I also want to get to your questions as quickly as possible. I might remind you that if you have a question, just send it by email or text or however you do it on Facebook Live, and then Jordan Rowe will get it to us. So I'm going to start off, Mayor, not to make you last, but you and I want to talk a little bit about how it's affecting city and county government. So, Clay, why don't you give us kind of an overview, update on the rising COVID cases and what you are seeing?
Well, it's rising quite quickly, as you just kind of gave a good summary there of how over the past 3 weeks, our rates have doubled every week. We report following the MMWR reporting week, so we go from Monday through Sunday. And I just looked as you were talking, Judge. We're at 108 cases for Daviess County here at midday on Tuesday, so 1.5 days worth of investigations, and we're already to the halfway point of what we reported out last week. So, we have seen higher incident rates in the Green River District Health Department than we're seeing right now, but we've never seen it increase and rise at the rate that it is now. Prior to 3 weeks ago, we never had a doubling in 1 week. So it's quite alarming. I think that's the word that I keep using. I think that it's time for everyone to kind of take notice. We were hopeful a month ago that we were past the worst of this, but we've got more work to do. And I think appreciate you giving the opportunity to have these conversations and to get that word out.
Clay, can you just real quick, can you tell us why we're seeing such a dramatic rise?
Yeah, the short answer to that is it's primarily the vast majority of the cases are those that are unvaccinated. So we have the tools that we at our disposal to prevent this. If you're not vaccinated yet, you need to seek out a vaccine if you're eligible to do that. So everyone over the age of 12 and above that doesn't have a medical condition that would prevent you from getting vaccinated, I'd say go out today and get vaccinated. Start, either get a Johnson & Johnson 1-shot series or start the 2-shot series. And until you're fully vaccinated, you need to be careful. You need to wear a mask when you're out in public. You need to watch your distance from other people outside of your household. Wash your hands frequently. All the things that we've been saying for the last year and a half still are applicable. And there is just a lot of disease in our community right now. And I told someone this morning on the phone, a lot of this is a numbers game. And there's a lot of chances right now to pick up an infection in the community. And if you're not vaccinated, you need to be especially careful.
Dr. DuFrayne, I want to reiterate or reinforce what Clay said. There at the beginning, think all the way back into March and April, and then all through the fall and particularly early winter, we kept saying the only tools we had in the toolbox were mask and social distancing, washing our hands, and avoiding large crowds. We have another tool in the toolbox now, and I like to characterize it as the best tool. What do you think?
I agree with that. I mean, if I really look back over the history, starting back in December of 2020, when we started doing the vaccines, so our vaccine rate continued to increase. People, however, were still masking, social distancing, hand washing. So all the measures were still in effect. Starting around April, when our vaccination numbers got high enough, we really started to see the decline, at least here in admissions at the hospital. So from April through June, we really went from a high of 50 admissions at any one time down to, on an average, about 2 to 5 at any given time. At the end of June, we were down to 1 patient. So my concern is that our vaccination rate has stalled, and people now really view the pandemic as being over. When I'm out in the community, no one has a mask on. It's a pretty rare finding anymore. If I go to any food store, if I go to any, inside any structure, it's the rare person who has a mask on. So I think the combination of our relatively low vaccination rates and the fact that we're no longer really practicing the things that we should still be practicing, wearing a mask, particularly if you're unvaccinated, but even if you're vaccinated, wearing a mask indoors when it's crowded, I would strongly recommend. Hand washing, social distancing is what's going to help us.
You were talking about that. I know I went to Kroger's over the weekend. I wore a mask for the first time in probably a month and a half or 2 months. I went to the health park yesterday. I wore a mask in and out, even though they didn't require me to have it. I went to the funeral home yesterday evening and I wore a mask. It's one of those things that we all got used to, and all of a sudden, things, as the cases dropped, we kind of got lackadaisical. I guess my question to you, Dr. DuFrayne, as the medical person, everybody's blaming the Delta variant, and we know it's here, but there are still other strains of this virus that we are catching that are hurting us. Tell me about the Delta variant. Is it easier to catch? Does it do more harm to people? And if you're vaccinated, are you any less likely to be infected?
So let's backtrack a little bit. So coronavirus is a family of viruses, and we usually associate those with colds. So when the first variant came out, which is what came out of China, we call that Alpha, and that was about twice as infected as the normal coronavirus. So now you have Delta, another variant, and that's also about twice as easy to catch as Alpha. So it's very easy to spread. It's very easy to communicate amongst all of us. So that's the first concern. The second concern is your symptoms tend to come on sooner and stronger. So you're much more likely to have bad symptoms and a complication. So Delta is a much more potent variant. And if you look across the country, CDC says 83% of all our infections in the United States now are Delta. We have another variant coming out, Lambda. It's been identified in a couple areas. We're not even sure what that means yet. But Delta right now is here. It's a little concerning in that coronavirus and most respiratory viruses are winter viruses. And the fact that we're here at the end of July with this surge is really concerning. It kind of shows you the potency of Delta.
Mayor, you and I have been preaching all the four things that were in our toolbox, and I think we've been preaching get vaccinated. Becomes a little disheartening when there is something out there that people can take and can do. Certainly, we don't. We're not forcing anyone, but what, in your opinion, what else can the city and the county do to get people on board and get them out here to? I mean, the city at Friday After 5, I think you guys were hosting some clinics. We've had clinics at churches. We've made things available. It seems like we just have a hard time getting folks there. There you go.
I think it just goes back to the same old thing we knew from the very beginning. There was a group of folks that did not or would not take the vaccine, period. There's some that struggle with the thought that it's experimental. And I think Dr. DuFrayne told me maybe August or something, the FDA may take that status away, but who knows? That may encourage some of them. What I hate more than anything is elected officials preaching, in a negative way to try and, we had some discussion about this in the last commission meeting where someone got just so aggressive that, I don't think that's helpful. I think we have to just preach protection and kindness to your family and kindness to your fellow man, because I don't know that we'll ever get, there's a lot of people who don't, Clay might be able to verify, there's a lot of people who've never had a flu shot, much less a vaccine that's supposedly experimental, that's got great results. So, I put a little thing on my city's Facebook page, actually Adrian did, and it was two pictures, masks or vaccine, so, I don't think we can browbeat them into doing this. I have two people in my office that haven't had it, and I've sat down with them and one at a time and just asked them, what are you afraid of? And try and ease some of their concerns. And both of them said, thank you very much. And neither one of them been vaccinated yet. So, and we've been open since day one. And I think I read somewhere where maybe 30% of the healthcare workers in America aren't vaccinated. So, the book gives you an opportunity to have free will. Trouble is, most people don't really read the book enough to find out what free will means. And I just think we have to be just supportive and try and get to the bottom of the equation as to just why they won't do it. And I don't have a lot of faith that we're going to get 80% of people in Daviess County vaccinated. I just hope we can last it and take care of the ones that we can and just rely on Owensboro Health and Clay to carry us through.
I think that one of the things that I remember back as the surge started to wane, the first few times around, I remember the mayor talking about ball game's not over and we can't stop doing the things that we were doing. And Mayor, I certainly agree with that. I also agree with the fact that if somebody says that if they don't want to do it, there's no forcing you. You're not going to be able to get, all you can do is lay it out there, make the case and go by the science and by the data. Unfortunately, on Facebook, those people will shame people who have taken the vaccine or who are considering taking the vaccine. And I don't have the time, the mayor doesn't have the time, you guys don't have the time to go on Facebook and refute all the false information that's going there. Before I go any further with some of the other questions, we have one of our first questions that says, if someone is vaccine hesitant, are there other alternatives to prevent or treat COVID infections? I think we just talked about some, but Clay, tell me, are there other alternatives?
There are, and of course, some of those have indications based on risk factors, and Dr. DuFrayne can probably speak to that a little bit better than I can, because I know that the hospital is prepared and equipped and has been doing those treatments. But yes, there are other treatments that are available. However, the risk of being infected with COVID, the risk of some of these other treatments are far higher than what the risks are associated with the vaccine. They're a relatively low risk of vaccine. And, when the mayor in his comments were talking about a lot of the disinformation and things that I guess maybe the labeling that you see on social media about this being an experimental vaccine that not, fully approved, a lot of that gets into the nuance of the technicality of the FDA's authorization process. I mean, the truth is these vaccines went through large clinical trials. And when the, FDA made the decision in December to grant emergency use authorization, there was sufficient evidence that they were both safe and effective. And then the advisory committee on immunization practices, another federal entity independent of the FDA, reviewed all of that data, and they made a recommendation to use these vaccines. And that was back in December. And literally hundreds of millions of these doses have been administered since that time, and there's been continuous monitoring of the safety and effectiveness of these things. There's probably not been a pharmaceutical in the history of the world that's had more interest and more scrutiny than these vaccines, and they are overwhelmingly safe. And I hope that people on Facebook hear that. You always have critics, you always have people who want to detract, but the truth is these vaccines work. They're safe. The risks are low compared to that of infection with COVID-19. And if you're not vaccinated yet, you really need to seek that out.
157 million people in the United States have been vaccinated. I would say that takes it out of the realm of experimental, wouldn't you?
Yes.
So the Dr. DuFrayne, a question. It says, are we testing locally for the Delta variant? Do we send those tests? I mean, they do a genome on the virus itself when they do swabs. I don't think we probably test everyone, but are they doing that?
We are. So here at the hospital, we're randomly picking positive tests and forwarding them to the state lab because we really want to know, is it in our community, which it's certain that it's in our community, but what's the real rate? What's the incident? So yes, we are sending those off to the lab, off to the state lab. And we'll continue to do so as long as the surge is going on, because not only do we want to look for Delta, we want to look for any other variant just to keep a track of it. So yes, we are.
Clay, another question that came in that says, with community spread now, do masks need to be worn by everyone, whether they're vaccinated or not? I think the implication is, do we need to go back to a mask mandate? What are your thoughts?
Yeah, I think that's all being discussed, and that's being looked at very closely in terms of what should be recommended and what's safe. I think on an individual basis, there is ample evidence that these vaccines are effective and that they provide a lot of protection. But what we're seeing now in a community setting where you have lots of unvaccinated individuals, that it really contributes to a lot of spread. And everybody who's been out recently can attest to the fact that hardly anyone is wearing masks. And we know that 44% of our population in Daviess County is vaccinated. So you do the math, there's a lot of unvaccinated people in masks, and that's contributing to what's going on. So I think from the policies perspective, that's being rethought some. CDC is scheduled to make an announcement at 2:00 today, and I think that probably recommendations for masking is going to be the subject of that. I don't have any prior knowledge of what it's going to say, but I can tell you what I'm telling people that contact me. I had a call as I was driving into work this morning from someone I know that has someone who lives at home with them that's taking treatments that compromise their immune system. And they asked, should they be wearing a mask? And I said, yes. I think that given the level of transmission in our community, I think we all could benefit from taking that extra step, being a little bit extra cautious. And to answer the question directly, I don't have the answers yet as to what that final recommendation is going to be, but it's coming. And I think that the experts in our country are looking at it quite seriously, and we're going to make adjustments based on the results that we're getting, because right now we're not getting great results.
Frank, before we got, I know yesterday we got some statistical evidence or a little blurb that was sent out by Dr. Kelly. You forwarded it to us. And we're talking about CDC and what's going on and their thought about nationally. We're interested in what's going on locally. How do we compare? How does the evidence that Dr. Kelly had sent out to us compare to the CDC stats?
So we're really falling right in line with it. So when I look at the stats that we sent out yesterday, CDC basically says that 97% of all COVID hospitalizations and deaths are in unvaccinated patients. Our numbers are 87.5% of all of our admissions since April 19th have been in unvaccinated people. We have a little bit higher rate of those who've already seen the vaccine. And I think that goes along to the health issues that are throughout our state. So lung disease, heart disease, diabetes makes us even a little bit more prone. However, even if you're vaccinated and you have exposure and you get the infection, you're still much less likely to have any serious issues with it. So the vaccine has really been proven to work. So 97% across the country, unvaccinated admissions, here 87.5%. If you look at even certain things like getting transferred or admitted to the ICU, 32 out of 35 of our ICU patients in the last couple of months, all unvaccinated. And every death at Owensboro Health related to COVID has been in an unvaccinated patient. So the numbers are clear. The evidence is clear. Vaccines work in this case.
You know, Clay or Dr. DuFrayne, everyone's making much ado about breakthrough cases. Like, oh my Lord, we even got vaccinated and we still had a breakthrough case. We still got the COVID. I don't know how many people get flu shots, get shingle shots, all those other types of vaccinations, and some of those people still come down with the disease. Are we seeing a lot of breakthrough cases, Dr. DuFrayne?
I'm going to say not that we're seeing a lot of them, but we are seeing some. And unfortunately, fortunately, the messaging has been pretty consistent. Really, no vaccine out there is 100% preventive. So COVID vaccine is no different. You are going to have some breakthrough cases, but what we've been saying all along, we in the medical community, in the science community have been saying all along is that when you look at things like morbidity, how sick you get from it, and mortality, those who die, those numbers are significantly lower than people who have not received the vaccine. So you're going to have some breakthrough cases. We're well aware of that. We still keep an eye out for it. But the vaccine does really help those patients if they happen to get it. Where we really see the difficulty is in people who have what we call comorbidities. Those who have significant obesity or diabetes or heart disease, they're more likely to have some serious consequences if they have the infection. But again, those numbers are small. Compared to the overall picture, vaccination works. Not being vaccinated doesn't work.
Clay, and just to piggyback on that, we said 83% of our seniors, 65 and older, are vaccinated. They used to be the largest group of cases, and it's by far the largest group of those people who passed away from COVID. What's the largest group now?
The last time I looked at that and did any kind of analysis on it, Judge, it was your 20-year-olds, 20 to 30-year-olds was by far the largest group. We've had a couple hundred other cases since I did that calculation on Friday. So it may shift around, but we are seeing younger and younger patients that are testing positive for COVID-19.
And Judge, that also corresponds to the admissions that we're having. So before, our admissions routinely were 60 and above. Now it's not uncommon to have 20 and 30-year-olds admitted unvaccinated with serious disease. On Sunday, we admitted a 21-year-old and a 75-year-old. Prior to that, 21-year-olds were rare. So we're also seeing it in a younger and younger age population.
we answered the one question, will there be new mandates to stop the current spread? I can't answer that. I don't know what's going to happen. We don't know what the CDC is going to say. Clay, I know you've been dealing with the school systems and their protocols for going back to school. Do you see any change in what they're saying they're going to do right now? I know that they were going to follow the CDC recommendations, but that seems to be up in flux. What's going on there?
Yeah, I would not know that I would fully agree with that what the plans that we've seen released are in full compliance with what CDC is recommending. I'm pretty concerned about the mask policy with students in schools as we return back to school, especially given the high rate of community transmission that we're seeing. I have talked with our superintendents. I have encouraged them to follow the CDC guidance, and if they elect to do that, then when we go back, anyone that's current CDC guidance is anyone that's unvaccinated should wear a mask while they're in school, if they're over the age of 2, which pretty much all students are, or all students are. But I am highly concerned about that. I think that if we have lots of people in a building together all day long without mask, with the transmission rates that we're seeing, we're going to see this get a lot worse. And I'm urging them, encouraging them. I'm willing to support them in any way that we can. But I think it's vitally important that they follow those CDC guidelines and that they require masks for unvaccinated individuals. And, we may see that revised to be more conservative. The American Academy for Pediatrics last week released recommendations, and they recommended universal masking in K through 12 education. It looks like Jefferson County's post in Kentucky to implement that in their school. You don't have to do too much research for news stories. We're seeing more and more cities that's the route they're going to go. And in my opinion, that's the smart way. That's what's going to take care of our kids, and that's what's going to take care of our community.
Mayor, I know back when this all started, the city and the county had to make some choices as to do we leave our commission chambers open? Do we leave our buildings open? What do we require in masks? I think both city and county government eased up a little bit. Any concern on the city side about going back to those more stringent policies as far as numbers of people who might attend a meeting?
No, sir. I already expressed to Nate Pagan, city manager, that our meetings will be closed to the public until further notice. And I don't think there's a big pushback on that at all. We generally get 3 to 5 from outside the public. We'll probably limit the staff members. We usually have a pretty good number of staff folks there, and those folks are out in the public and always around a lot of people. And so we're planning on doing that. Our next meeting's not till the first Tuesday in August, but Clay's going to get it all fixed before then. So we may be able to have folks back in. In fact, last week when I was ending the meeting, I forgot about the open public comment. Somebody had to stop me and we had 4 or 5 people there that wanted to speak. So I think we just err on the side of caution. I got 2 granddaughters that work at OH and at midnights in that CCU. So I'm scared to death for them, for people coming in. So we'll close ours. And I think Nate will probably issue some statement as it pertains, because our firefighters and our policemen, they're going to still be out doing their job. So, and we lost a sanitation worker about a month ago from COVID. So it's still pretty frightening, but at the same time, just have to use the precautions that are available, and some will, some won't, but we probably won't have people until we get it slowed down again.
County's going to pretty much follow that same protocol. We did open our meetings for a while. We asked that folks call and kind of make a reservation so that we could limit the number of people and socially distance them. I had actually said that when we got into the green, that we would open it back up again. Well, we got down to, I think, 1.2 cases was the lowest I recall seeing, and then we started back up. So we're probably going to do the same. I don't have any plans right now unless Clay gives me a call and tells me I need to start requiring masks or recommending masks be worn in the public spaces, in the courthouse. It's pretty much up to the county clerk, PBA, and those folks whether they require masks on people when they come in. But it is real. I've lost a couple friends to this, and everybody wants to talk about it's not real, it's political. It doesn't know whether you're a Republican, Democrat, Independent. It doesn't care whether you're old or young. If you know, if a lot of the young folks in particular, Dr. DuFrayne, they're worried. Number one, we heard a worry about myocarditis as a result of taking it. But I don't think on the other side, the people didn't talk about all the myocarditis that occurs to people who become infected, which is much worse, I think. Speak to that a little bit.
And that is correct. So we seem to want to pick on a few cases of something that happens with the vaccine and really ignoring the fact that if you get COVID, the incidence of myocarditis is significant and can be long lasting. We have a number of patients, even young patients, who are fairly incapacitated as they slowly recover. So yes, we always seem to forget what the disease does, but it's real. We see it all the time.
A couple more questions came in. One of them, are the courts going to have a mask mandate? I would say Chief Justice Minton will make that decision. We don't tell the courts what they may and may not do. So I would tell you just to hang around and see. I think we answered this, but I'm going to pass it around again. What's the percentage of vaccinated versus unvaccinated people in the hospital for COVID right now, Doctor?
We're talking about patients?
Patients, yes.
Yeah, so we have 19. We have 19 patients in the hospital right now, and all but 2 are unvaccinated.
Okay, so it's a pretty high percentage that those who are unvaccinated are going to end up in the hospital. The ones who do.
Yep.
One of the questions, Mayor, when you and I were talking, that I wanted to bring back up, because the city and the county are faced with some upcoming events. And some of the people ask, or one of the questions asked, is it safe to attend these large events where there are lots of people? And I'm thinking on the city side, the air show. I'm thinking on the county side, romp out at Yellow Creek Park. And we have a big fireworks display coming up on Labor Day. Mayor, have you guys talked about that at all, how you might address it? Clay, I want you to piggyback on this when the mayor finishes and what your thoughts are. Mayor?
Yes, sir. I already called Clay about this because we've got quite a bit of money invested in this, as does OH here, and so we're trying to, and I guess the thought process is most of it's outside. Hopefully we can spread out. And if we they've sold tables and things such as that at the convention center for both functions, and we'll be working with the convention center to make sure there's some added social distancing, and and hope. I don't really want to start out talking mask right off the bat, but and I don't know a way to find out if they've been vaccinated, and we'll just try and put out a press release to try and let people know, and maybe we can get Clay to write it for us, and we'll be able to give them as much notice as possible, because from the things that I've been reading, like this Delta variant seems to go through faster, doesn't it? It doesn't kind of stay in one spot. I was reading something the other day about Israel kind of catching it and getting rid of it or moving it on a little quicker. So I'm hopeful that this nasty thing just has a pretty good speed to it and can maybe help with those issues. But we're looking at them day to day, and are going to go on the advice of Clay Horton and Dr. DuFrayne. And it is what it is, and you don't know that the federal government's not going to tell the Thunderbirds they can't come. So we've got that we're looking at as well. So it's an interesting dynamic. So that's what we're looking at.
Mayor, just as a side, some of the good things that come from this pandemic, and I want to say thank you to the city I mean, having multiple places for fireworks on the 4th of July was a wonderful venue, a wonderful way to spread things out throughout the community and, you know, not have as many people all in one setting. So thanks for that. That was a pretty great deal.
We made all the dogs in the town mad instead of just the ones downtown.
Yeah, I hear you.
So they did. But quite honestly, I was at the river on the fireworks, and I'd say there were between 5,000 and 10,000 people on the river that day. So, but that turned out pretty well, actually.
This is a funny question, but there are people asking, where can I get a vaccination? Where can I get a vaccination, Clay? I saw where sites have closed down. There are not as many, but at the same time, there are vaccination sites all over. There's more vaccine than we know what to do with.
Yeah, so the vaccine supply is still plentiful in our community. You know, there's a couple of different ways that you can find these, you know, very easily. Vaccines.gov is a searchable website that will help you locate a pharmacy or a health clinic that has these. You know, you can call the health department. We'll be happy to get you scheduled. We're concentrating a lot on our community events, you know, going out and do satellite locations. Dr. DuFrayne can speak to this. I had someone ask me the other day about wanting to get someone vaccinated that day. Our schedule was, you know, we had people already deployed out in the community, didn't have a clinic operating close by to them. And I pulled up Owensboro Health's website. They've done a great job where you can even pick your manufacturer of your vaccine and find out those opportunities. And there were appointments that same day. So, and then plus, you know, when I'm out, when I'm at Kroger, when I'm at Walmart, I'm seeing signs about no appointment necessary. You can walk up to the pharmacy counter and you can get a vaccine. And I don't know if Dr. DuFrayne wants to talk any more about the availability at Owensboro Health, but I think it should be relatively easy to find a vaccine in our community. And if you can't, give me a call. I'll help you find one.
Okay.
And I agree. So just go to the Owensboro Health website and it'll take you right to the vaccine appointment page. And like Clay said, there are plenty of openings almost every day.
Could I ask a question? What if they don't have internet? What are their options then?
So they could call their physician.
Okay.
Their physician will put the order in for them and actually can tell them when to go.
All right. Good.
Yep.
Okay. One of the questions that just popped up, it says several states and cities are requiring vaccination for healthcare workers and their employees. Is this an idea, something you would support? I don't know if that, Dr. DuFrayne, you would support it. I don't know if it's for local government. Most of the things that I have seen have been the private employers requiring their folks to become vaccinated.
Right. And I've seen the same thing where New York City has done it, California has done it. Not that they're absolutely mandating that you get the vaccine, but you either get the vaccine or you're going to undergo weekly testing.
Go ahead.
Oh, so those are the things that they're really mandating. We are not mandating that here. We're working with our team members to continually to increase our vaccination rate. And trying to make the vaccine as easy as possible, but we have not mandated it, and we're just keeping an eye on it and monitoring it.
Another question, can I schedule a booster shot after 6 months? I think the answer is nobody has come out with a booster yet. Nobody has proven the need for a booster. So you could try to, but I think your physician or the clinic would tell you no. You know, I'm sitting here looking at another question, which is what's your advice to employers, Clay, or to churches? And I know that some of the Catholic bishops have been talking about requiring masks again. What do you think employers should do? I know we encourage, and particularly first responders will wear a mask when they don't know the status of those folks, just like they did back 3, 4, 5 months ago before things started to ease up. What would you recommend that employers do, and, you know, our churches and other organizations in the community?
Yeah, I think for employers, I would do everything that was in my power to encourage my workforce to get vaccinated. I think not only is it in your workforce best interest for their health, I think it's in your business's best interest in terms of making sure that you've got a reliable workforce. And you're seeing more and more of that. We've seen it through incentives. Someone told me today that they had a family member that works up at Toyota, and they are implementing requirements where you have to wear a mask if you're unvaccinated, and you have to be subjected to regular testing if you're unvaccinated. And so I would say every workplace is a little different. Probably where your leverage points and what you can do to encourage your employees are a little different. But I think it would be in every business's best interest to help and support their employees and help them get vaccinated. For churches, I think it's similar. I mean, I think we've here have done a lot of projects with churches in terms of vaccine clinics, and I think that's great to see. They've helped provide access. I think getting the word out. I think church leaders are often trusted members or trusted leaders within their congregations. Give a voice to counter some of this disinformation that we've seen. And then when we have high rates of community transmission like we're seeing now, certainly I think you want to put in other safety standards, practices, distancing, mask wearing. We're at a critical point now where I think we need to be doing all that we can to kind of change course and get these rates back down.
Yeah, I think they're a lot more trusted than elected officials for sure.
Right. The Dr. DuFrayne,
Yes, sir.
I had COVID back at the beginning of the year. Is there any reason for me to go and get a vaccine now? Don't I have natural immunity? Do I need to worry about being reinfected?
So yes, you do need to worry about being reinfected because there are now, there's a lot of evidence that says you can get this again. We don't know if you had the original COVID and now there's Delta, are you at much more risk for that? So the current recommendations are if you've had an infection, you can wait up to 90 days, but after that, you should really strongly consider a vaccination.
Okay. Well, let me ask you a question. There's so much allergy here in the Ohio Valley. I've been vaccinated, have no problems, and all of a sudden I get a little tickle in my throat. I start to sneeze a little bit. I'm stopped up in the head. Not running a fever, no nausea, no loss of smell or taste. Do I need to go get tested?
I think that's really an individual question because it really depends on your situation. If you live in a household where people are vaccinated and you have nobody who's immunocompromised getting cancer treatment, those kind of things, you can try and ride it out. One of the issues with the vaccine is for those people who are infected after they are vaccinated, their symptoms tend to be really mild. And you are less likely to actually spread it to someone else. So it really depends on your situation. If you have people around you or you yourself are really at risk of a serious infection, then yes, I would definitely get tested.
Right. Clay, if I'm fully vaccinated, I test positive, do I have to quarantine?
Yes, we call it isolation. Quarantine is someone who's been exposed, and we're making sure that you don't turn positive. But yes, our guidance to those that test positive, that have already been vaccinated, is to protect those around them, protect their community, stay at home until their symptoms resolve, and do the same isolation that we ask all of the other positives to do.
Okay. Mayor, did you have something to say there?
I was just going to ask
Okay.
Dr. DuFrayne or Clay, the one, has there been a lot of information out on, to Al's question, just exactly what are the symptoms that you may think that you have COVID? A lot of people give a bunch of different ideas, and is there a boilerplate idea of just, is it a catch-all, or can you just nail it down, say if you've got yada, 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 there's a pretty good chance? A lot of people have asked me, because I've seen patients since day one, haven't stopped, always wearing a mask. And when they come in, my patients are pretty rural, and it's amazing how many of them have been vaccinated. And so sometimes people get confused on what Al's saying. I have a sinus infection. Do I have COVID? Is there a standard operating procedure for nailing down the symptoms of COVID?
So it turns out, if you really look at all the COVID infections, there's about 15 different symptoms. The three most common are fever, sore throat, and cough. You can have one or all three of those. But a lot of patients get GI symptoms. They can have chest pain, diffuse chest pain, stomach pain, diarrhea. There are just a host of symptoms, but the most common ones are fever, sore throat, cough.
Okay, thank you.
Okay. Well, we're getting close to the end. We've been doing this, believe it or not, for a little over 45 minutes. It's sure time goes fast when you're having fun. We have gotten a couple of other questions. Is an antibody blood test useful, Dr. DuFrayne?
Yeah, it's only useful to see in the past have I had the infection. So
Okay.
if you're having symptoms, we don't check for an antibody. It takes a couple weeks for that to show up. But if you test for an antibody, if you were confused or you were uncertain, geez, I thought a cold 3 months ago. If you get an antibody and it's positive, it could have been COVID, but we don't use it in active diagnosis.
And certainly it's not useful if
One
you
thing you
had the
might-
vaccine, right?
Correct. Yep.
Yes,
So those
yes,
can be
Mayor.
different antibodies.
Okay, yes, Mayor.
One thing to think about is, short as our blood supply is, if you go and donate blood, they'll test your antibodies for you after you donate the blood. So you
Right.
could
Mhm.
you could kill two birds with one stone. I hate the word to kill, but you know, and
Yeah.
we're really low on our blood. So I think it's kind of a neat way, if somebody's concerned about the antibodies, you help them out at the Western Kentucky Blood Center and go donate.
Clay, one of the questions that we got, and good point, Mayor, because we are short of blood. They are calling for it
Yes.
on a lot of fronts. Clay, one of the questions, my child is 12. Can I schedule a vaccination, or do they have to be 12 or older, right?
Yes, they have to be 12 or older. And the only vaccine approved for anyone under the age of 18 currently is Pfizer, although we're hearing that Moderna will be shortly. So if they're not quite 12 yet, they're not going to be eligible for vaccine. I know I've got an 11-year-old who feels left out. Unfortunately, they'll have to continue to rely on these other strategies, wearing a mask, being careful, but until they're 12. And then, we're hopeful somewhere around midwinter that we'll see authorization for kids younger than 12.
Right. Well, we're close to the end. I'm going to ask the last one, which is going to be pretty controversial, I'm sure, and it really doesn't apply to Dr. DuFrayne. I'm sure it doesn't apply to Clay, although we put the enforcement issue on the health department's back. We blamed him a lot of times. And it is, are you planning to enforce masks at large community events? And my answer to that is, haven't thought about it, not planning on it at this time. We have always followed the state and the CDC guidelines, and to my knowledge, they're not calling for that yet, particularly for community events that are occurring out of doors. Dr. DuFrayne, I'm going to give you Mayor, do you have anything to add to that?
I'm just going to call Clay. Whatever he tells me, that's what I'm going to try and do.
Good point. I should have said that myself. Dr. DuFrayne, I'm going to give you, we're going to go around, and one more time, do you have anything that you'd like to tell the community? Anything you'd like to say?
It's particularly if you've not had anybody in your family who's had COVID and you've not lost a loved one, it's easy to minimize what this disease can do, what this infection can do. The thing that we're hearing more and more across the country is true regret among people who are admitted with COVID and weren't vaccinated. They really come out now and while they're in the hospital saying, I really wish I rethought this. I really wish I got vaccinated. So it's a serious disorder. It can really lead to serious illness and even death. And the vaccine works. It's that simple.
Clay?
I think, well, at the risk of sounding like a broken record, I am a broken record. We just once again encourage folks that haven't gotten vaccinated. We've been doing this for a year and a half now, and it seems like COVID-19 always throws us a curveball. But at the same time, we've learned a lot. And I know everybody's tired of it, but let's not forget the lessons that we've learned. We have better tools than we had. And we have vaccines now, which we didn't have this time last year. Take advantage of those. Be smart. If you're not fully vaccinated yet, continue to do those things. Wear a mask, socially distance until you are fully vaccinated. And if we do that collectively as a community, we'll change this direction.
Mayor.
Thank you, Judge. I want to thank Clay and Dr. DuFrayne for their leadership through this whole thing. I've talked to a lot of my friends, I don't know if they're friends or not, mayors across the Commonwealth, and always talking about how well the subject is presented by Dr. DuFrayne and Clay Horton. And I don't always get that same response from some of my fellow mayors. So our community owes y'all a debt of gratitude, and we thank you for your leadership during this pandemic. And as I've said to several people, I doubt it's going to be the last one. So to Clay's point, we are learning a lot, and I hope somebody's taking a lot of notes.
Yep.
Thank you.
Okay. Just to answer one question that came in while we were finishing up, there are clinical trials, to my understanding, Dr. Frayne, going on for children under 12. I don't know when that result will be out. I'm sure the minute that the vaccine is available for those 2 to 12, you will be notified so that you can schedule your children. I know that a lot of folks have looked to the state government, federal government, to local governments, the mayor and myself, for leadership in this, and I think we've stepped up and done what we could do. I get frustrated sometimes from folks who say, we never see you talk about this, we never see you saying anything about COVID when it's on our lips 24 hours a day, 7 days a week. We're passing along information. But then I'll get people say, I don't read the newspaper, I don't listen to radio, I don't see TV, the only thing I do is Facebook. Well, I can tell you folks, I quit doing Facebook about the second time I posted something regarding COVID, and after 3 responses, it got into a political fight, a political debate. I had a good friend of mine, and I'll say it again, and I was quoted this morning, he said the ball is in our court, meaning in the city and the county's court, it's in the hospital's court, it's in the health department's court, and that's not true. The ball is in the public's court, because I think you heard from each and every person on this today, we're not forcing, we're not pushing, we're not trying to shame. We're giving you the best data that we have at hand, and it's backed up by statistical data from our local hospital, our local health community, and the national health community, that getting a shot, getting the vaccine is the best tool that we have in our toolbox today. So with that, I'm going to say thank you to each and every one of you. Thank you for your leadership through this last, year and almost 5 months. It seems like it's never ending. But I think if we persevere, we listen to the data, we listen to the science, that we can see the light at the end of the tunnel. So thanks, everyone.